actually an infertility diagnosis is as emotionally challenging and trying as a cancer diagnosis. Most couples come to see us because they've been trying to get pregnant and haven't been successful. There are lots of different reasons why that may be the case. Some of the most common reasons are a lady may not be ovulating or releasing an egg every month. There can be male factor, which happens in about 40 to 50% of the cases, as well as other reasons like endometriosis, or even sometimes things like premature ovarian failure, where a lady's ovaries have aged much faster than her actual biologic age. Signs of infertility, obviously, we do have same-sex couples who come in to get assistance in achieving a family, but we also have heterosexual couples who come in. Most of them have been trying for about a year or more. If a lady is over 33, 34 years of age, if they've been trying for 6 months, at that point is really where we would recommend evaluation. Or if someone doesn't have periods on a regular basis, because that's really a sign that they may not be releasing an egg, and if they're not releasing an egg, then they're not going to have anything for the sperm to be able to fertilize. There are a number of options available, kind of going from least aggressive to most aggressive in some form. You have really kind of ovulation induction, which is where a woman would take medications, either oral or injectable or a combination thereof, often used in combination with inseminations or IUIs. That's often a place that people start. Then we can progress, of course, to things like IVF, in vitro fertilization, where we retrieve eggs and create embryos outside of the body and then put those embryos back into a woman. With IVF, there are some different variations. So we can do testing on embryos to make sure that they are chromosomally normal. We can also do testing if somebody has what we would call a single gene defect, something like cystic fibrosis or Huntington disease, so that we could help minimize the risk of a child having one of these conditions. And then we also work with couples who need either donor egg, donor sperm, or sometimes even use donor embryos from people who have completed their families, and they have donated embryos to embryo banks for other people to be able to use to help grow their families. There are very few things that we can't help you with to get you a baby. It may not be the path you necessarily wanted it to be. It may be a little bit more challenging, or we may have to consider options like third-party reproduction, but there's always something we can do. There are options available. Even sometimes ladies who don't have a uterus, those individuals can use gestational carriers. So potentially we can create an embryo using her egg, the patient's eggs, her partner's sperm, create an embryo that's biologically theirs, and then another woman would be able to carry the pregnancy for them to have their own biologic child. So there's a lot of options available.